Chaos erupted in the emergency room like a storm unleashed after a catastrophic bus crash. Patient after patient poured through the doors, a relentless tide of pain and panic. Amid the frenzy, a small woman with long brown hair quietly slipped on her gloves, her movements calm, almost invisible. "Can you believe it?" A doctor leaned over to his colleague, whispering with a smirk, "For the next 3 hours, she'll just be shuffling paperwork." Oh, how wrong he was. 3 hours later, the head surgeon, Dr. Whitmore, stood frozen, his face drained of color, watching in disbelief as she expertly handled a complex wound, something he thought only seasoned doctors could manage. His voice trembled as he muttered, "Who trained you like this?" Meet Laura Keating, a 32-year-old woman of Irish-American heritage, her long brown hair always tied back in a neat ponytail, her calm eyes sharp enough to see what others missed. She was the new ER nurse at St. Alder's Hospital, stepping into the chaos with quiet determination. On her very first day, Laura arrived early, her focus unwavering. She meticulously checked the medicine cabinet and medical supplies, her hands moving with a purpose no one seemed to notice. A young doctor, full of arrogance, scoffed, "Why are you being so careful? This is the ER. If we run out of something, we'll just call for more." Laura just smiled. Did she know something he didn't? She didn't argue, didn't raise her voice, just carried on with that quiet confidence. During her first shift, something caught her eagle-like gaze. A patient with unusual bruising patterns, subtle signs everyone else overlooked. Without fanfare, she reported it to the attending physician. That single observation? It saved the man from internal bleeding that could have stolen his life. Hours later, no one mentioned her quick thinking, but the patient's family left a small box of cookies and a heartfelt note. "Thank you for noticing her." Can you imagine the gratitude in their hearts? Yet her colleagues, caught up in the ER's whirlwind, thought she was too slow, too quiet for the chaos. The charge nurse even pulled her aside, her tone sharp. "Maybe you should work in the back office, Laura. You don't seem cut out for frontline patient care." Laura nodded politely. But oh, those calm eyes flickered with something unspoken. A spark of defiance, perhaps? Week after week, the pattern held. While other nurses rushed around, their voices loud and frantic, Laura moved like a ghost through the emergency room, silent but purposeful. She'd adjust a patient's IV drip with a gentle touch, reposition someone struggling to breathe, or check vital signs others missed in the blur of activity. Her actions saved lives, but did anyone notice? The results were undeniable, yet no one seemed to listen. At a staff meeting, a senior doctor griped, "The new nurse is too hesitant. In emergency medicine, we need people who think fast and act faster." Oh, if only he could see the miracles unfolding in Laura's wake. An elderly woman's heart medication adjusted just in time. A teenager's concussion symptoms caught before they turned deadly. A construction worker's infected wound cleaned meticulously, staving off sepsis. Small miracles, all because of her quiet vigilance. Laura carried a small notebook, not for praise or recognition, but to track every patient interaction, to sharpen her ability to read the silent signs of medical distress. Her locker was bare, just a change of clothes and a water bottle, but hidden in her scrub pocket was something special. A silver pen, engraved with the letters DP. In medical terms, it stood for pressure differential, a subtle clue to hidden dangers most couldn't detect. That pen was her talisman, a reminder that in medicine, the quietest threats are often the deadliest. Can you feel the weight of that symbol? During lunch breaks, while other nurses gossiped about weekend plans or grumbled about tough patients, Laura sat alone in the hospital cafeteria, her eyes glued to medical journals on her phone, a simple sandwich in hand. She wasn't here for small talk, she was studying trauma protocols, diving deep into emergency procedures. One afternoon, a paramedic rushed in a car accident victim, conscious and chatty, so everyone assumed he was fine. But Laura? One glance at his skin color and pupil response screamed danger. She approached the attending physician, her voice soft but urgent. "Doctor, I think we should run a CT scan immediately." He brushed her off. "The patient's alert and responsive. We've got more urgent cases." Laura didn't argue, she never did. But 2 hours later, that patient collapsed from internal bleeding, barely clinging to life. Her warning had been spot on, but who connected the dots? No one. They were too busy to notice the quiet nurse who saw danger before it roared. Tucked in her scrub pocket, alongside that silver pen, was another secret. A thin silver bracelet etched with coordinates 36.3398 degrees N, 43.1189 degrees E, the exact location of Mosul, Iraq. That place had forged her, taught her to stay calm when lives teetered on the edge. Then came a Tuesday evening that changed everything. The radio crackled with an alert that stopped every heart in the room. A multiple vehicle collision on Highway 45. Bus versus semi-truck. 4 casualties incoming. ETA 7 minutes. The ER transformed into a battlefield in an instant. Dr. Whitmore, the head of surgery, took charge like a general, his voice slicing through the chaos. "All hands on deck. Trauma Bay 1 through 6, active now. Senior nurses, take the critical patients. Residents, handle the walking wounded." His eyes landed on Laura. New nurse, Station 4 paperwork, and basic triage only. No medical decisions without supervision. Did he underestimate her? Laura nodded, her face unreadable. She'd learned long ago not to challenge those who'd already judged her. The first ambulance screeched to a halt, paramedics rushing in with a middle-aged woman, pale but conscious. Laura was tasked with her intake forms while a resident examined her. But Laura's sharp eyes caught what the resident missed. The woman's breathing was shallow, not from panic, but something far worse. Her skin had a grayish tint, internal bleeding. Her blood pressure was slipping, too subtle for the monitors to catch yet. Without a word, Laura started an IV line and began fluid resuscitation. The resident snapped, "I didn't authorize that." "She's going into shock," Laura said calmly. "Her mean arterial pressure is dropping." He checked the monitors, everything looked normal to him. He opened his mouth to argue, but then the patient went into cardiac arrest. Laura was already in motion, her hands on the crash cart before anyone else reacted. Her chest compressions were flawless, her medication orders precise, saving the woman's life. Dr. Whitmore watched, speechless, as Laura handled the code blue with the precision of a surgeon. Could this really be the paperwork nurse? The second ambulance brought a teenage boy with minor cuts and bruises stable, they thought. But Laura? She took one look at his eyes and knew better. A quick pupil response test revealed unequal dilation, possible traumatic brain injury. Without waiting for permission, she elevated his head 30 degrees and began documenting neurological signs every 15 minutes. When he started vomiting 2 hours later, Laura was ready with anti-nausea meds and positioned him to prevent aspiration. How did she know? The third patient, an elderly man, seemed alert, chatting away. But Laura noticed his left hand trembling not from fear, but something else. She checked his medical bracelet. Diabetic. His blood sugar was crashing, yet he refused treatment. Kneeling beside him, Laura's voice cut through his confusion. "Sir, I need you to drink this orange juice, just a small sip." Something in her tone, calm, commanding, made him comply. 20 minutes later, his blood sugar stabilized, and he grinned. "That's the best orange juice I've ever tasted." Can you imagine the relief in that moment? Patient after patient came through Station 4, and Laura caught what others missed. A pneumothorax from breath sounds, a severed artery she compressed until surgery, a spinal injury she immobilized to prevent permanent damage. Dr. Whitmore couldn't stay away from Station 4, drawn by her quiet competence. Her hands moved with the confidence of someone who'd done this 1,000 times. Her voice stayed steady even as chaos swirled. During a brief lull, he had to ask, "Where did you train before coming here?" Laura paused, her pen hovering over her notes. A flicker crossed her face, not fear, but caution. Different places, she said softly. You learn to adapt. It wasn't an answer, but her tone said, don't push. The final patient was a young mother who'd shielded her daughter in the crash. Her arm likely broken, her body covered in lacerations. Standard protocol called for x-rays and pain meds, but Laura noticed her breathing shift when she moved. Palpating her abdomen, Laura's heart sank, internal bleeding, possibly a ruptured spleen. This time, she didn't hesitate. She locked eyes with Dr. Whitmore. This patient needs emergency surgery now. He started to question her, but her gaze stopped him cold. Without another word, he ordered the surgery. 90 minutes later, the surgeon confirmed Laura's call. The woman's spleen was lacerated in 2 places. Without Laura, she'd have died within hours. How could one nurse be so right? As the last patient was wheeled to recovery, Dr. Whitmore stood in the now silent ER, his staff exhausted but proud. His eyes found Laura, quietly restocking Station 4 with methodical precision. Every supply was checked twice, every piece of equipment tested and placed just so preparation that could mean life or death. He approached her, voice low. That was exceptional work tonight. Laura glanced up. Just doing my job. No, he insisted. That wasn't just nursing. That was battlefield medicine. Her hands froze, and she met his gaze. Those eyes, oh, those eyes. They weren't those of a rookie nurse, but of someone who'd seen horrors most couldn't imagine. As Laura gathered her things from her locker, Dr. Whitmore noticed something, a thin silver bracelet on her wrist. When she reached for her coat, her sleeve revealed a small tattoo, not art, but military coordinates. The truth about Laura Keating was unraveling, and it was more extraordinary than anyone could have guessed. The truth about Laura Keating started unraveling the next morning, and oh, how it shook Dr. Whitmore to his core. He couldn't shake the image of her from the night before, her movements so precise, so automatic, like a master conductor leading an orchestra in the chaos of the ER. How could someone with her supposed background, a simple nursing school grad, wield such profound knowledge? It didn't add up. Driven by curiosity, he picked up the phone and called Dr. Marcus Chen, a military surgeon he'd served with during his brief time in the Army Reserve. They'd stayed close over the years, and Chen now worked at Walter Reed Medical Center. Marcus, I need your help to figure something out, Dr. Whitmore said, his voice tinged with urgency. I've got a nurse here who handled trauma cases last night like she'd been doing battlefield medicine for years. Her name's Laura Keating. She claims to be a recent nursing grad, but I'm starting to think there's more to her story. What's the deal? There was a long, heavy pause on the other end, and when Dr. Chen finally spoke, his voice was slow, almost reverent. David, are you telling me senior combat medic Laura Keating is working as a civilian nurse at your hospital? Dr. Whitmore's stomach dropped like a stone. Senior combat medic Laura Keating, a legend in military medical circles? She'd served 3 tours in Iraq and Afghanistan, her final deployment in Mosul in 2017. David, Chen continued, his tone filled with awe. This woman kept 6 critically wounded soldiers alive for over 4 hours during an ambush, working alone with barely any supplies under enemy fire, no less. The phone felt like a lead weight in Dr. Whitmore's hand. She never mentioned any military service, he stammered, stunned. She wouldn't, Chen replied. Laura was part of a classified operation that went terribly wrong. When she came home, she was battling serious trauma. Last I heard, she'd vanished from the military medical world entirely. Most of us thought she'd left medicine for good. Chen's voice grew quieter, almost disbelieving. The skills you saw last night? Laura honed those in places where one wrong move meant watching someone die. She can perform emergency surgery with a combat knife and a flashlight. She once kept a soldier alive for 6 hours after an IED explosion ripped away half his chest cavity. Can you even imagine that? Dr. Whitmore sank heavily into his chair, his mind reeling. Why would someone with such extraordinary qualifications take a low-level nursing job? Because she's starting over, Chen explained. Some people come back from war desperate to forget everything they learned, but Laura, those skills are woven into her very being. She can't switch them off, even if she tries. After hanging up, Dr. Whitmore sat in his office, staring at Laura's personnel file. The resume was a lie, a nursing degree from a community college, basic certifications, no prior medical experience. It was so cleverly crafted that it had slipped through every background check. How had she pulled that off? Driven by a need to understand, he sought her out in the hospital cafeteria during her lunch break. There she was, alone as always, poring over a medical journal, a half-eaten sandwich in front of her. "Mind if I join you?" he asked, his voice softer than usual. She looked up, and a flicker of weariness crossed her face. Did she know what was coming? She nodded to the empty chair. "I had a fascinating conversation with Dr. Marcus Chen this morning," he began, watching her closely. Laura's sandwich froze halfway to her mouth. She set it down with deliberate care and met his gaze, unblinking, for the first time since he'd known her. "What did he tell you?" she asked, her voice steady but laced with exhaustion. "That senior combat medic Laura Keating was one of the finest trauma specialists the military ever produced," he said, leaning in. "That she saved more lives in impossible situations than anyone could have dreamed." Laura was silent for a long moment, her eyes distant, as if wrestling with ghosts. When she spoke, her voice was steady but so tired. "That person doesn't exist anymore." "The hell she doesn't," Dr. Whitmore shot back, his voice rising with conviction. "I watched her save 6 lives last night with skills no civilian nurse should have." Laura sighed, pushing her lunch away as if it had lost all appeal. "Dr. Whitmore, I applied for this nursing job because I wanted a fresh start, a clean slate, no expectations tied to who I used to be." "But why?" he pressed, his heart aching for her. "Because over there, every decision was life or death," she said, her voice cracking slightly. "Every soldier I couldn't save haunted me for months. When I came back, I couldn't bear that pressure anymore. I just wanted to help people quietly, without the weight of the world crushing my shoulders." Dr. Whitmore leaned forward, his eyes searching hers. "But you can't turn it off, can you? The training, the instincts, they're still there, aren't they?" "No," she admitted, her voice barely above a whisper. "I see things others miss. My hands move before my brain even catches up. Last night, when those patients flooded in, it was like I was back in the field hospital in Mosul." "Tell me about Mosul," he urged, his voice gentle but insistent. Laura fell silent for so long he thought she might not answer. When she spoke, her voice was a faint whisper, heavy with memory. "The 15th of June, 2017. Our convoy was hit by an IED, then small arms fire. 6 wounded, 2 critical. Our medic was killed in the blast. The extraction helicopter was 40 minutes out, but those soldiers wouldn't last 10 minutes without surgery." She paused, staring at something only she could see, her eyes haunted. "I performed field surgery for 4 hours straight while insurgents shot at us. No anesthesia, no proper tools, just combat knives, field dressings, and IV tubes. I kept those 6 men alive by sheer willpower and every scrap of medical knowledge I could pull from my mind under fire. My God, all 6 made it home. But me? I couldn't keep carrying the weight of those life and death decisions, not like that. So I left the military, went to nursing school under a new name, and tried to find a way to help people without the burden of command." Dr. Whitmore leaned back, everything clicking into place. Her quiet confidence, her ability to spot problems before they became crises, her unshakable calm in the face of panic. It all made sense now. "Laura, what you did last night wasn't just good nursing. It was exceptional trauma medicine," he exclaimed. "You caught complications that residents with years of training missed." "I know," she said simply, her voice heavy with resignation. Then why hide it? Why pretend to be less than you are? Laura's gaze locked onto his, and he saw a raw pain in her eyes he hadn't noticed before. Because being exceptional means everyone expects you to save them all. And when you can't, when you lose someone because you made the wrong call or moved too slowly, it tears you apart from the inside out. Dr. Whitmore nodded slowly, his heart heavy with understanding. But you're still doing it, Laura. You're still saving lives. I can't help it, she confessed, her voice trembling. When I see someone who needs help, I can't walk away. The training runs too deep, the instincts are too strong. Then maybe it's time to stop hiding from who you really are, he urged, his voice filled with hope. Laura closed her medical journal with care, her movements deliberate. Dr. Whitmore, I appreciate what you're trying to do, but I'm not ready to be senior combat medic Keating again. I may never be. She stood to leave, then paused, her eyes fierce with resolve. But I promise you this, as long as I'm in your ER, no one will die because I was too afraid to act. Laura never spoke of that conversation, and Dr. Whitmore honored her silence. She kept working as a regular ER nurse, taking the same shifts, handling the same routine tasks. But something had shifted in the ER's atmosphere. Could you feel it? Word of her performance during the bus crash spread quietly among the staff, not as gossip but as deep professional respect. Nurses started asking her subtle questions about patient assessment techniques. Residents began listening when she offered suggestions. Laura didn't seek these moments, but she didn't shy away either. She was a quiet force, changing the ER from the shadows. One quiet Tuesday night, a young nurse named Jessica approached her, her eyes wide with curiosity. Laura, can I ask you something? Last week you looked at Mrs. Patterson and knew she was having a heart attack, even though her EKG looked normal. How did you do that? Laura considered the question, her expression thoughtful. Women show different signs during cardiac events, she explained. Mrs. Patterson was sweating, but not from exertion. Her jaw was tense, and she kept touching her left shoulder. The clues were there if you knew where to look. Could you teach me how to see those signs? Jessica asked, her voice eager. For the first time in months, Laura smiled a real, warm smile. Sure, but it's not just about memorizing symptoms. It's about seeing the whole person, not just the obvious problem. Over the following weeks, these teaching moments grew. Laura quietly shared how to spot subtle changes in breathing, skin color, or posture clues to hidden medical issues. She never called them training sessions. She simply answered questions, offered observations when asked. One evening, Jessica caught a stroke in an elderly patient who'd only complained of dizziness. Her quick action saved the woman from permanent brain damage. Tears in her eyes, Jessica found Laura in the supply room. I never would have caught that without what you taught me about facial asymmetry, she cried. Laura nodded, her approval quiet but genuine. You trusted your instincts. That's what matters most. Where did you learn all this? Jessica pressed. Laura paused, her gaze distant. Different places, she said softly. Situations where getting it wrong wasn't an option. Her teaching continued, always understated. Laura never sought the spotlight or claimed credit for her students' successes. She shared knowledge freely, trusting others to use it well. Dr. Whitmore watched this transformation with awe. Laura was creating a ripple effect across the ER. Nurses grew more observant, more confident. Patient care improved measurably. At a monthly staff meeting, he marveled, I don't know what's happening, but our nurses are catching critical issues earlier than ever. Patient outcomes are soaring. A senior nurse spoke up. Laura's been sharing assessment techniques with us. Informal but incredibly helpful. Dr. Whitmore nodded, a knowing smile on his face, but he kept her secret. After the meeting, he caught Laura alone. You're teaching them, he said, his voice warm with admiration. They're asking questions, she shrugged. I'm just answering. You're making them better nurses, better professionals, he insisted. Laura's expression softened. Everyone deserves the knowledge to help people effectively. Is this what you want? He asked. Teaching instead of practicing advanced trauma medicine? She thought for a moment, her eyes searching. Maybe, she said. It's satisfying to share what I know without carrying the weight of every outcome. She paused, then added, if I can teach 5 nurses to catch problems early, that's more lives saved than I could manage alone. Dr. Whitmore smiled, his heart swelling. You're still saving lives, Laura, just in a different way. Yeah, she whispered. Maybe that's enough. 3 months later, someone scribbled next to Laura's name on the duty roster. Cool head, warm heart. Who wrote it? Laura never asked, and she never erased it. Her story is a powerful lesson in heroism and service. She represents countless veterans who return from war with skills and experiences civilian life often overlooks. They choose quiet roles, paramedics, volunteers, coaches, not for lack of ambition, but because they've learned true fulfillment comes from helping others, not chasing glory. Those 3 hours during the bus crash, they didn't just save lives, they revealed the hidden depths of talent all around us. In hospitals, schools, fire stations, there are people whose skills far surpass their job titles. Laura didn't demand respect or flaunt her expertise. She led by example, sharing knowledge generously, creating a legacy that stretched beyond her own actions. Her story begs the question, how many quiet heroes walk among us, unnoticed? In a world that celebrates the loudest voices, we often miss the steadiest hands. Laura chose nursing not to abandon excellence, but to redefine it. Her silver bracelet, etched with Mosul's coordinates, reminds her that every life matters, every decision carries weight. Yet her choice to start anew as a nurse shows a different kind of courage, one that thrives in the shadows. The next time you meet someone quiet, unassuming, remember Laura. They might just be the one you'd want by your side when the world falls apart.